Okay, hi everyone, welcome. Thank you all so much for being here today. We have a wonderful panel today of med students at all stages of their training, and we're very excited to tell you today, or just to give y'all some advice and talk about some of the things that we considered when we were choosing medical schools. So we can just start off with some quick introductions. I can go first. My name is Martina. I am a first-year medical student. I am from Miami, Florida. I went to undergrad there and I took one gap year before starting medical school.
I'll go next. I'm Brandon. I am a second year. And I'm also in the MD PhD program, meaning I am getting a PhD right after my second year, and then going back to med school after my PhD. And I was actually an undergrad at UCLA as well. I graduated in 2017. I majored in MIMG. So yeah.
Hi, my name is Anya. I'm actually also in the MD PhD program a little bit further ahead. So I'm in my 4th year of my PhD, which again means that I completed 2 years of medical school, now 4 years of PhD, and about to go back to medical school. I did my undergrad at UC Berkeley, and then I actually did 2 gap years at the NIH.
I can go next. Hi, everyone. My name is Nathma. I'm a 4th year med student, almost done. Originally from Missouri. I went to Brown and I took one gap year also at the NIH.
I can go. Hi, everyone. I'm John. I'm a first year medical student, just regular, no MD PhD. I also took one gap year and I worked at a children's hospital.
Okay. And then we have Nguyen who will be monitoring the chat in case any of you guys have any questions you want to submit through the chat Q&A function. Okay. Hi, Nguyen. Okay, so we got a lot of really good questions, people thinking about where they should go for medical school. So we'll start off this first part of the session just with a general discussion of some of the important things that we considered, major and minor factors, I guess, that we considered while choosing a medical school. So things like location, clinical research opportunities, community patient population. If you could think back to what are some of those things that were important to you when you chose UCLA, or when you were just weighing, where you should go. Maybe you could just reflect on that or share what those were.
Yeah, I can begin. So again, I graduated from UCLA, and during my time as an undergrad at UCLA, I really fell in love with the city. I really had nothing to complain about Los Angeles. So I really told myself, hey, I can stay here for another 8 years because MD PhD. And so yeah, that was one of the biggest factors, whether or not I can imagine myself living there and being happy there for a significant amount of time. I have family down here. And yeah, everything is just great here. So I felt that I was spoiled and I wanted to continue being spoiled living here.
I very much second that. As another LA transplant now with 4 years here, I feel just lucky all the time. But I think for me, I think there are 3 big things that I considered 4 years ago, and then also looking back, think have been really important. For me, the first is kind of the makeup of the class and also support in terms of academics, which I think often can tie together because often your peers and your classmates are some of your biggest supporters over the last 4 years. For that, I know it's been so hard with Zoom interviews and Zoom second looks and things like that. But for me, it really was kind of just the vibe that I got talking to people. I remember specifically at my second look, I talked to a ton of current students about the student-run homeless clinic and mobile clinic, and I loved how excited they were about working in our community and about being able to do something valuable for others, even as a first year. And I really like that. And I feel like our biggest strength right now is my class in terms of the people that I know. So it is important to see how you feel and how you get along with the people who are at whatever schools you're looking at. The second thing that I think is huge now that I've been through it is the clinical training sites. So I didn't know anything about this when I was looking into med school, and I was very fortunate to end up here because I feel like we have everything. And I have loved that over the last 2 years, you know, having access to Reagan, which is a tertiary quaternary center, 2 different county hospitals at Harbor and Allevue, the Kaiser system, Cedars, which does its own thing, and then clinics all over LA. It's so valuable being able to work with all the different types of patient populations that can access care at these different places, as well as learning how to function in all of those systems. So I would really look into that. Oh, also the VA, I can't remember if I mentioned that. So I would really look into that if you can, in terms of what clinical sites you'll learn at, especially as a third year or a second year with some of the scheduling changes and some of the newer systems. And then the last thing I think is just other personal factors that are important to you, like proximity to family, location, things like that.
I think that was really comprehensive and really hits a lot of the points that I wanted to address too. I think to summarize, I was personally looking for kind of like a major city center and a diverse patient and community population, because I think that is also really reflected in the medical schools that tend to serve those areas. And again, I'm very much seconding the point that your med school and just general academic like support community here is going to be incredibly important throughout these like 4 years of a lot of learning, but also a lot of like personal and professional development. So it's nice to be going through that with someone, and bonding with your classmates ahead of time is great. Although don't worry, you will have plenty of time to bond during med school, but also paying attention to the factors of what it is you want from 4 years in your 20s and where you might want to find yourself professionally.
I can just kind of echo a lot of what everyone said. Some great points, especially about training centers and opportunities for that. Personally, for me, it kind of went down to similar to, I forget who said that, but just like the vibe in general that I got when I interviewed, and we didn't have second look because of COVID, but in general, just how like people interacted with you and treated you and like sold the school to you, I felt like was really kind of powerful in my mind, because it ended up being that there was like 2 sorts of schools, and that like ones were like really trying to sell you on the school and like wanted you to go there, which is fine. But then there were other schools that I felt like more took the approach of like, we want what is best for you in terms of like fit and style, and like this is who we are. And I found myself really attracted to the schools that were much more just kind of upfront about that and more like community oriented.
That's a really good answer. And you already started answering what was going to be my next question, which is how important was the interview impression in your decision to come to UCLA, or just to choose a medical school in general, I should say?
Yeah, going off of that, there were interviews that I went to where, this school was like one of my top 5 or, a top choice initially when I was applying. And then when I interviewed there, got to know the students a little better, got to feel the vibe. I kind of wasn't feeling it so much anymore, just because, I don't know, the vibe was off, not because like they were off, but like I don't know, our personalities didn't really match that well, in my opinion. And that school I ranked lower because of that interview. And I'm not saying that you should like, judge people when you like meet people at interviews and whatever, but you should definitely be mindful of like what you're looking for in like a learning environment and a non-learning environment as well. You're not going to be doing academics 24/7, obviously. So just be very mindful of what you want and whether or not a school fits that vision?
I think that at the interview stage, the interpersonal interactions that you go through with faculty and with people who are interviewing alongside you and the current students are really those little determining factors. I mean, the possibly unquantifiable vibes that you get when you just feel comfortable somewhere, or you feel excited somewhere, or you feel the opposite. So I think it's an important experience to have, whether or not in person or virtually, and it determined a lot about how I decided to come to UCLA.
I kind of second all those things. I don't have anything too insightful to add on top of that, except to trust your gut. And if you feel a certain way about a program, I think there's probably a reason, and you know yourself best, and you know where you can flourish and thrive best. So I do think it's important to give those feelings merit.
Yes, all very good advice. So location is a very important factor. I think most of us share this sentiment. Did any of you, do any of you have any advice for choosing a school when you're taking into account things such as significant others or family, or were those things that anyone had to take into consideration when they chose a school?
I could start. Oh, sorry, Anya.
Go for it. Go for it.
So I went to school in Philadelphia and have been in Philadelphia area my entire life. So this was definitely a big leap for me. My entire social network is still on the East Coast. But really kind of what drove the decision for me was like, I would ultimately like to end up back in that area. And it's more like an experiential thing of, I'm not really going to have another opportunity to do something like this. And in terms of like determining your ultimate network of practice and your kind of professional network, that's much more determined by like residency necessarily than med school. So those things, in addition to just like the opportunities available at a school like UCLA in terms of, like we mentioned before, like various hospitals, diverse patient population, all that stuff really kind of pushed me to take the leap and go somewhere far.
Yeah, I think LA was always in my mind as a great place to live. So in terms of location, that really was a determining factor. But personally, I actually had a significant other that we were fortunate enough was able to move with me. And that, of course, was part of a huge discussion. So I think it really does, it's incredibly individual. There's no like prescription for it. There's no right way to approach this. Ultimately, maybe you might have to make sacrifices or ask for sacrifices, and this is going to be something that permeates your medical career, or maybe not. So it's really hard to kind of generally address this, other than to say that from my personal experience, it's entirely possible.
Yeah, I mean, I have nothing insightful to add other than when we say location, it doesn't necessarily only mean like weather or, how close you are to family. It also means, like, as we've mentioned before, what kind of patients you're going to see, and whether or not it's like a big city or like a rural community type of environment. And all of those, whether or not you know it now, will play a huge factor in your training and your experience in medical school.
Okay, thank you. I can start to ask some more specific questions that we got from some of our attendees. So how would you recommend I learn more about a school with COVID restrictions? Is it okay if I reach out to students? It's a pretty, yeah. That was a pretty straightforward one. Does anyone have any other ideas? I think reaching out to students is pretty good. If you're reaching out to people you might want as mentors.
Yeah, I think it's more than okay. I really think you should like really proactively do that.
I think that's an excellent idea and also highly recommend it. I went through something similar applying to residency over Zoom in the last year, and I found that some of the most helpful things I got were talking on the phone one-on-one with residents. And I assume it would be the same with med students because it's a little easier to hear someone's truly honest perspective when it's just you and them. And one thing I asked when I was applying to med school was always making sure to ask what somebody would change about their med school. And I think that can often tell you a lot in terms of one, what the student body or whatever this particular person cares about, as well as two, just in general, what they say and how important or not important that is to you.
I think that's a great way of asking the question that I also asked when I was applying, which was kind of like gauging how people felt about the cons and what they were willing to share about the cons of particular programs or schools, because I feel like that leads just to a better understanding of the kind of environment it breeds. So I think that's an important set of questions to also ask. And, you know, when you do talk to a current student, conversation is probably going to flow naturally, but do come prepared possibly with the things that you really do want to know so you can compare across programs.
Yeah, I can just add, I think it's really important to, like, it's a good idea to reach out to current students, but it might also be a good idea to reach out to the other people who've been accepted. I know it's still pretty early, but for example, my year as an MS1, we didn't have second look, as John said. So we didn't really I didn't really know who was in my class until like way later, like way after I unfortunately made a decision. But actually, no, not unfortunately, because my classmate ended up being amazing. But it's, you know, it's risky, you never know. But definitely try to see if your class already has like a Facebook or a group me or a group chat or something, because our class started one, I think, in the summer, and it was really nice to see, you know, how my potential future classmates were interacting. It was like relieving to see that people were normal and everyone was everyone was happy and friendly and getting along. So yeah, current student opinion matters, but also just see who your classmates are going to be. I think the sooner you can talk to other admitted applicants at these schools, the better. Because yeah, you're going to rely on these people a lot for the next 4 years for, you know, emotional support and whatnot. So pretty important to know who they're going to be.
It's also helpful to compare notes, which was something I did with some of my interview trail friends. Like, oh, do you remember what they said about this program? Or what were your vibes on global health at these schools that I saw you at? Things like that.
Okay, so we can do another more specific question. So this person is considering an out-of-state versus California school. I feel like many other admitted students might be in the same situation. So this student would like to know if they'd be able to come back to California for residency if they go to school out of state, or if there are any challenges or benefits of leaving California for medical school. What are y'all's thoughts?
So I think the short answer is yes, you are definitely able to come back to California for residency or go wherever you apply to and get, you know, matched to for residency. It's a bit of a separate process from the medical school, I guess, application. So that would be like one of the minor factors I would consider when deciding where to go to medical school. I think in terms of going into a school like UCLA, the UC system is specifically, you know, it's a state, a medical school system, which has amazing higher education, but at the same time is kind of catered to retaining doctors that will practice in these or similar communities. That's not to say that it excludes others, but there's, I mean, I think definitely a bias towards California-based applicants, or at least applicants who have expressed an interest in staying and practicing in California. I think in that sense, going to a medical school and then ended up practicing in a similar community might help you make things easier down the line. But at the same time, once you're a trained physician, you have these translatable skills that will follow you to any community that you choose to serve.
Yeah, I think like I had a similar mentality that John did, where I get this opportunity to go somewhere else, like to spend a good part of my life somewhere else, or 4 years somewhere else. I mean, I think it's, if you've spent your entire life in California, I don't think you'll have a hard time matching back in California, especially if you have family and ties. in California, which I think I haven't gone through the residency application process yet, but I hear that's something that programs consider. But you know, if you've been in California all your life and you're interested in seeing maybe what the East Coast is like, or just seeing what the Midwest or any other part of the country is like, you get this, you know, kind of a once in a lifetime opportunity to go be a student somewhere else. And then you can always, you know, try to match back. So I guess that would be one benefit of leaving California for medical school. I think you grow a lot as a person, like when you have to move out of your house and when you have to live far away on your own for the first time, you definitely grow. You learn a lot about yourself. So I think if you're uncomfortable, that might be a good sign. You know, like stepping out of your comfort zone is how you grow. So yeah, those are just some benefits I think of just in general, like leaving your state to go to med school. Just the new opportunities, connections, experiences you'll have in another part of the country.
I also want to second the comment about every possible configuration of states for med school and residency really being possible. It is true that a lot of people, or that a higher percentage of people will stay at their home med school or their home state, kind of everywhere across the board if you look at match lists, but also true that at all those schools, you have students going elsewhere. So for example, in my class, 3/4 of my class matched in California, but the other quarter is all across the country. And then similarly on the flip side, I'm going into neurology, and UCLA neurology actually has all 9 people from med schools outside of California. I think I met a couple of them, and some of them do have ties to California in terms of family, but I assume that probably not all of them do. So it really is okay to go either way.
Yeah, I mean, one con I can think of leaving your home is just, you know, you'll be a little further away from the connections you have back home, but you know, there's always FaceTime. The years really do fly by. So I think if you really want to go back, you'll be back before you know it. Okay. Did anyone want to add anything else, or should I move on to the next question? No. Okay. Okay. Okay, so I know this can be kind of a sensitive topic for a lot of people, you know, talking about finances and money, but was cost, you know, is cost something I should strongly consider when choosing a med school? Yeah, it's not a very easy question to answer. I think this depends a lot on each individual person's situation, you know, like a unique financial situation and other considerations that you may have. I think it's a really personal thing to decide, you know, how to put a price on a medical education. You know, this could be a whole nother topic on its own. Financing medical school, we could, yeah, have another hour dedicated to just talking about finances, but yeah, if anyone has anything they would like to add.
Sorry, I'm not too qualified to answer this question just because the finances of the MSDP program are a little bit different.
Okay, yeah. Okay, sorry about that. Okay, so when choosing a medical school, were there any additional things you wish you had considered, such as class size, residency opportunities, gut feelings, etc.? I think we talked a little bit about some of these.
I just wanted to emphasize again, I really didn't think about it until I was much further along into like ultimately deciding where I was going to go. But like the training sites and opportunities where you rotate is definitely something that's like really important in terms of getting like exposed to various levels of like healthcare, because I mean, you could end up at like a huge academic medical center, or you could end up at like a community hospital, and like you could like one over the other better, not necessarily. So just that knowledge is really important, especially ultimately then when you go and apply to residency.
Another consideration is like school ranking or reputation. I will say that didn't play a major part in my decision making, and I'm excited to hear what the other panelists have to say. But I'll just share that, you know, I obviously chose UCLA, but my second choice school was ranked, like if you look at like new US News Report or whatever, it's like ranked like 80 or something. So you might ask like, Brandon, why would you consider like UCLA versus, which is, I don't know, a top, I don't actually know what UCLA is ranked. Let's just say top 10 versus like 80. Like you're crazy, but like it really did not play a major part in my decision making because, you know, in medical school, you're really going to learn the same thing as all the other med students around, you know, around the US. Like they all teach the same material. All the doctors need to learn the same content. So it, you know, in that regard, you might think, okay, what is this ranking or reputation really measure? And to be honest, it's not a lot. It's just prestige. But that's my opinion. I don't know if anyone else has anything to say.
I think I tend to agree, just because once you're past a certain threshold, which I'm not going to put like a top number on because I can't, the material is very similar. I think the educational approaches are very similar. And although this sounds strange to say, I think the caliber of people that you're constantly surrounded by is also very similar. So there's a lot more that goes into making such a personal decision as to where you're going to get your medical training than just looking at rankings. And again, it's not just any one factor. And I mean, who's to say that if I felt more comfortable or had family ties or had other personal reasons to go to, you know, ranked a school that's ranked 80 versus a school that's ranked number 1 or 10, whatever, that decision probably would not be affected by rankings for me either, but rather by the superseding personal needs that would be fulfilled there.
Yeah, I love how you're like moving into my next set of questions without me even asking. Next, yeah, I was gonna ask about the rankings, and we actually got a question in the chat. Do you think residency programs take med school ranking into account? I do think that's kind of tricky, especially that the step exams are, you know, like licensing exams are going to be pass fail now. So I mean, I've heard people express concerns about, you know, how do I make myself stand out? So I think it's really tough. I think in a perfect ideal world, we would say ranking doesn't matter, and it's certainly not the most important factor. You know, on the same theme, if you have extremely strong ties or extremely strong reasons for going to a 80th place or whatever school, then by all means, I mean, you should do that. You need to prioritize what's important for you in life. But I think with schools, I don't know if anyone else felt this way, but there came a point where all schools are great. You know, like everyone's going to try to make their school seem great, with a few exceptions where either the interview was just completely like gave me weird vibes, or, you know, there was just like something about the school that I wasn't really sold on. If you don't consider those things, it's really hard to choose a medical school sometimes, you know, especially if you have really strong pros for each school. So maybe use it as a tiebreaker. It's really hard. But yeah, I don't know if anyone wants to add any other thoughts to ranking.
In response to the residency program question, I think that the answer is probably yes to a certain extent, only because the people reading your applications will recognize some schools just by seeing them more often, or they'll have colleagues at some places. None of this I don't think is necessarily appropriate, and it's definitely not good. But I do think that there is some discrimination against very small schools or very new schools. And, you know, we know that there's tons of discrimination against international graduates when looking for residency spots and things like that. So I think that it can help you in a certain way, but it's not the only factor. It's just one very small aspect of your application. I also want to say that I think these like US News rankings can be kind of artificially inflated or deflated depending on weird things like tuition a certain year or like a certain year's MCAT scores, things like that. So I would say take it with a grain of salt and look more into what the students are like, what the faculty is like, things like that. And also because they're calculated in such weird, not transparent ways, I would say there's no difference between 6 and 9 or like 25 and 30 or 50 and 60 really. I feel like within any sort of group of maybe, I don't know, 20 or 30 schools, they kind of all have the same ranking to me.
Yeah, and I imagine instead of, like ranking, it's more about the connections, I guess, people in the school have. I mean, again, I haven't been through the residency application process, but it's just things I hear, like a lot of times having certain connections can really help when it comes to residency. So I think, at bigger schools, you're just bound to find more people with more connections, and that's just kind of the reality of it. So I would say, yeah, like ranking and that stuff is it's not something you should be completely blind to. I mean, you have, like everyone has the right to prioritize whatever they want in a school, but definitely shouldn't be the most important thing. Not as important as some of the other things we talked about. So I'm just kind of tangentially related to this question. Thinking of how to phrase this question. How important is the strength of a school's residency program that you're interested in when choosing to go to that school? I don't know if my question made sense.
Do you mean the residency program of a certain specialty that you're considering, or just in general residency?
Of a certain, if you know of a specialty you're interested in, is that something you should also consider?
I think that's tricky because I have definitely changed my mind about specialties I'm interested in maybe like 3 times already. So I think locking yourself into a specialty that you're dead set on before you're even starting medical school is a little bit a disservice to yourself. And again, residency is a little bit divorced from medical school. So if you go to a medical school that you think now has a slightly weaker residency than you intended, then you can apply elsewhere.
Yeah, I'll say I gave it absolutely zero thought. And yeah, I feel like it's too early to be thinking about that now because as Anya says, your mind will change a lot, your interests will change a lot, so I feel like it might be too early and to be pigeonholing yourself.
I was just gonna add on the school's ability to make you a good doctor and for you to grow and learn well in a good environment, I don't really think is necessarily correlated well with a residency program's rank, especially if you're basing it off of one residency program. Yeah, I mean, I don't.
Okay, so here's a more specific question. How important is class size in choosing a medical school? What are the pros and cons to a big versus a small class?
This was something that I was worried about before starting here because I think UCLA was the biggest class size of every school that I applied to. And looking back, I think it doesn't matter at all. I'm very happy that I had a big class size because I think that made it really easy to find my people. you know, I think that's a pro to bigger class sizes, that no matter what, you're going to have a lot of friends who share some sort of similar interest, just because there are so many people and the probability is high. I also feel like I think I was worried about kind of being lost in the crowd or not knowing my class and only knowing my friends in my class. And I think that is also, I've been totally disproven. I feel like I could sit down next to anyone in my class and strike up a conversation with them, just from having spent, you know, the first 2 years with them constantly. So at least from my experience here, no real cons to a big class size, in my opinion.
I have to say that familiarity with your entire class, and the bigger the class, the more people you have that with, is really exciting, especially years down the line. Like when you see each other after those 2 years are over, it's like you've been closest friends this entire time. It's really nice. It's a nice feeling.
Honestly, I feel like I see more of my classmates in the wards on the hospital or recently on interviews. And it's so nice because, especially third year, when you're just being thrown from team to team and working with all these new people, it seems like every classmate that you run into is this long lost friend in the hospital. And it's such a nice experience. I also just want to say one other thing. One of my friends is in med school in this program in Alaska, and I want to say his class is something like 20 people, maybe 15. And you know, I think there are a lot of pros to that as well. He's very close to everyone in his class. He knows everything about everyone. But he also was telling me that he was excited to meet new people during his third year, because I think that's kind of the extreme of class sizes and exposure.
Yeah, I will say med school is very different than undergrad, where, like undergrad at UCLA anyways, class sizes are huge. It can be difficult to get to know your professors, yada, yada, yada. But in medical school, there's like the student to faculty ratio is like way smaller. Like you really do have the opportunity to like get to know your classmates and the faculty and whoever very intimately. It's not the same like large class as you think of when you think of your undergrad experience.
Yeah, I think I'll just go ahead and say I agree that having a bigger class is nice. The chances of you finding, I guess, people you really, really get along with, like those, really close lifelong friends, is higher, I guess, if you have more people in your class. But you do have the concern of losing that tight knit feeling with the big class. But I honestly feel like you don't, as like some of you have already said, like it's weird and it sounds weird, but you can actually be close to like 170 people. You might not necessarily talk to them every day, see them every day, but I think just having like that familiarity, having a shared background, like having gone to med school at UCLA, for example, I think it really helps. And I think it's really nice. It can be a little intimidating if you're more of a shy person like I am, like going out and talking to people, but it's worth it. Everyone's going through the same thing, more or less. So you have a lot more in common with your classmates than you think, or at least you will once you all start med school.
I think that point about shared interests is huge, because I think that one of I find really valuable how diverse my class is in terms of background and experiences and things like that. But it feels like no matter what, you all kind of want to do the same thing. And something about medicine excites you in a way that everybody just shares, which I feel like is a really personal thing to be able to connect with someone and to be able to connect with 180 people on. So I think that makes making friendships a little easier and quicker. Also, just shared difficult experiences.
Yeah, I agree. I think it's definitely easier to make friends in medical school than it was in undergrad. Everyone is so nice. Okay, should we move on to the next question? Okay, So this one's a little less related to choosing a medical school, but what were some of the things that you did in the months prior to medical school to choose? To prep. I guess that includes like moving for people who moved across the country or getting familiar with the area, things like that. If you can think back to what your summer before MS1 was like.
I mean, definitely like there's a transition, at least for me, there was a transition of like becoming more of an adult. So like planning for that was important and just like figuring out like what clothes I'm going to bring and like how I'm going to furnish my apartment and like anything like that. Establishing good habits is good too. Like if you like to work out or like whatever else you like to cook, like trying to have those before you start all the stresses of med school is like really important and helps your overall well-being. On the converse side though, honestly, just do nothing. Like you don't need to start anything. You don't need to prep for anatomy. Like just enjoy your months. Like please, like I stopped working like the first week of June before starting med school, and then we started in like the last week of July, first week of August, and that I'm so glad I did that as opposed to like working until I came here, just because it was a great reset, a great just like time to enjoy with my friends and family before I started the stresses of school. And I really think that's important to just have like a mental reset and be in a good place before you start school again.
I think that was a really smart decision because I did the opposite, where I did work up until like a week before starting medical school. So caveat number one is I moved into an apartment that I didn't get to see beforehand. Not the best. And then I guess it was an interesting thing for me to reset, for all of you who may have taken a year off or maybe won't, but not having been in school and then going back to school was a bit more of an adjustment than I anticipated. I think having the discipline to sit down and study again was something that definitely took adjusting to. I want to say that maybe having more than 10 days between like work and school would have helped me out with that, but also just being aware of possible changes to your lifestyle. And definitely please don't try to study in advance. You'll do plenty of studying in the next 4 years.
I also did not study and also want to say don't study. And I think I had 2 months or a month in between my job and med school, and I visited family who were outside of the country. I spent a lot of time with my parents in Missouri. I like packed up some clothes and we drove here. That's really all that I did that was productive at all in that time.
Yeah, in case you didn't hear the other 4 people say it, don't study in advance. That's all.
Yeah, 100% echo what everyone else has said. I was living at home before moving across the country to come to UCLA, so I didn't have to like think about rent and stuff. So I was able to quit my job a few months earlier than I thought, and then just spend time with my family. Yeah, learn how to cook, get into a good exercise routine. Yeah, just things like just like figure out ways that I like to take care of myself and make sure that I am fed and happy before, because you know, figuring that stuff out when you have a full course load is a lot harder and a lot more stressful. Yeah, traveling might be kind of hard right now still, you know, we're kind of starting to see the end of it. Maybe with more people getting vaccinated and cases going down. So maybe you can do some sort of road trip. I think that was a pretty popular thing with people in my class. They road tripped across the country to move, which, I mean, their pictures look nice. So I think it was a good idea. And then, yeah, like Anya said, if you can avoid signing a lease without seeing the apartment 100%, I think you should do that. I didn't do that. I was too scared. I was considering it and I was too scared to do that. So I just went with the safe, like graduate student housing. And I'm glad I did, because it can be scary. Landlords can be scary. Okay, so we're reaching the end of our panel. It might be harder for people who did this a long time ago to remember, but I guess some people wanted guidance on how to choose a medical school with like the AMCAS Choose Your Medical School tool. Like I did this last year and even I am having a hard time remembering what I did last year. I don't know if John, you're also in MS1 with me. Do you remember that process? Or any deadlines or anything? I remember April 30th being a deadline.
Sorry, my Wi-Fi was being bad. What was the question?
Oh, no, it's okay. Just people asking about how to commit to a school. Do you remember how to do that?
Didn't we have to write?
Oh, yeah. It's like there was a day where it was like you narrowed down to 3 schools. I think that was like April 15th or something. And then there was another day where it's like you narrow down to 1 school, but you don't necessarily have to like commit. Because then there's all like the wait list stuff. Like personally, I didn't get in here until like May like 15th, I think, if I remember correctly. And I had already kind of said I was going to go to another school, but I hadn't committed. I don't, it's confusing.
Yeah, it is pretty confusing. I vaguely remember there being a date where you have to, like, it's not enforced. Oh yeah, and when you're here too, your first year, maybe you remember as well. I remember there being a date, might have been April 15th, where you're encouraged to reduce like your choices down to 3 schools, and then I think you can like start to commit to schools on April 30th or something like that. I think the AMC website is usually pretty clear. I don't remember too much. Do you have any other thoughts, Nguyen?
Oh, one thing too I wanted to add, check like individual schools because their like date to commit by can vary. Like some could be like June 1st, others could be like August 1st. So that's just something important to know if you're like riding wait lists and whatnot.
Yeah, I should check with the AMC. I think what both Martina and John have is correct. April 15th for up to 3, and then April 30th, so you can only do 1. That's called plan to enroll. And then you can keep that until whenever, until the commit to enroll. So that period you can wait for waitlist, but then after like the deadline for commit to enroll, you have to choose. Like let's say for UCLA, that will be June 1st. If you accept on June 2nd, then we'll rescind your offer, so don't do that.
Yeah, when in doubt, you can always like email the school and ask like when do I have to commit by? And usually I think they'll be pretty clear. Yeah. Be pretty sad if you missed a deadline and then a school thought you weren't interested. So always ask to be safe. Okay. So I'm looking through some more questions that we got. We covered a lot of them. Just really quick, does anyone have any experience negotiating scholarships? Is that something that can be done with schools? It's completely okay if not.
I think I used one scholarship offer to negotiate with other schools. I think if you have any current scholarships, it's always helpful to tell other schools that you're interested in, like this is what I'm getting here. And I think they did increase the scholarship that I got at the second school, but I didn't end up going there. But it did help, you know, if I had wanted to go there.
I tried, but was unsuccessful. But I had other friends who were successful, but in general, just like shoot your shot, like figure out what package you get and just be like, this school is offering me this. I am interested in going there or whatever. Like, what can you do for me? And usually they're pretty honest about like, we could do this, we could match, we could give you more, or just like, we're not able to do anything for you. And I don't know. I mean, it's hard, but just put on like your best poker face.
Thank you for your insights. But yeah, I mean, we're approaching the end. I think we covered a lot of ground. So thank you all so much for all your advice and, you know, like sharing your experiences with us. Does anyone have any like last minute thoughts or recommendations or additional advice for anyone who might be stuck between some schools?
One last piece of advice I'll give is really just pick a school based on like what you are looking for. Because if you end up going somewhere because like, I don't know, your parents like said go here or like stay close to home or whatever, and you don't want to, like, you might regret it in the end. And honestly, like, just go with the school that you want to go with. Like, you'll have some sort of gut feeling at the end of it, and yeah, just click that enroll button or whatever.
I would say if you're still trying to decide, I would talk to two groups of people, one being current students at whatever schools you're comparing, and then second, your family or whoever knows you best, to kind of talk through what you think about those schools and see what they think. It sounds like you actually like more.
Yeah, or, oh, sorry, go ahead.
Oh, I was just going to quickly say that if you have an opportunity to go to second look, which I understand isn't really clear, at least for the current MS ones, and I don't know what's happening this year, but if you have an opportunity, do it. If you're at all considering a school, like make sure to go to whatever they're hosting.
Yeah, I was just gonna say, definitely echoing what was said. Definitely reach out to family, or if not, you know, mentors that you've had from undergrad and beyond. Just like bounce ideas off of people, see if you can get any other opinions. But I think at the end of the day, the only opinion that really, really matters is yours, because you're the person who's going to be going to medical school. You're the person who's going to be, you know, like going through the curriculum and living, you know, at the school, living with your decision. So I think it's really hard to make a wrong decision. At the end of the day, you know, schools are going to, you're going to be a great physician no matter what school you go to. And I think you adjust to whatever situation you end up in. And yeah, you just have to make the best of whatever situation you choose, and just trust yourself that you made the right one. Okay, and so with that, I think we'll end this Med Mentor Monday. Thank you all so much for being here. This was so much fun. Can't believe it's time flies. It's already been a year for us MS1s, and you know, more years for our other panelists. So yeah, I hope you enjoyed, and I hope you learned something, or I hope we brought some new perspectives. And good luck choosing your medical school, and congratulations for your acceptance.
Yes, congrats.
Congrats, everyone. It's a great achievement.